Chapter 18:5, The Sense of Hearing. The ear has two sensory functions, hearing and balance. Balance is the same thing as equilibrium. Sensory receptors for both hearing and balance are located inside of the inner ear. Each consists of hair cells with stereocilia, which are long microvilli that are sensitive to mechanical stimulation. These are sensitive to movement. That's why they make them mechanoreceptors. Here's our diagram of the human ear. The ear is divided into three parts: the outer ear, the middle ear, and the inner ear. The outer ear consists of the pinna, which is the external flap of the ear. It collects and funnels the sound into the auditory canal. This is an opening with fine hairs and modified sweat glands. These modified sweat glands are located in the upper wall of the canal, and they secrete earwax, which helps guard the ear against the entrance of foreign materials, air pollutants, and microorganisms. The middle ear begins with the tympanic membrane, or eardrum, and ends at a bony wall containing two small openings covered by membranes. Openings are called the oval window and the round window. Between the tympanic membrane and the oval window are three small bones called ossicles. Individually, these are the malleus, known as the hammer, the incus, known as the anvil, and the stapes, or the stirrup. The malleus adheres or sticks to the tympanic membrane, and the stapes touches the oval window. An auditory tube or eustachian tube extends from the middle ear to the nasopharynx, and this permits the equalization of air pressure. It's what causes your ears to pop. The third portion of the ear is the inner ear, which is filled with fluid. There are three areas. First part is the semicircular canals and the vestibule. Both of these are going to function in equilibrium. The cochlea functions in hearing, and it's shaped like the shell of a snail. Hearing requires the ear, the cochlear nerve, and also the auditory cortex of the brain. Sound waves enter through the auditory canal. The tympanic membrane vibrates as the sound waves strike it. These vibrations are amplified across the middle ear bones. The malleus takes the pressure from the inner surface of the eardrum and passes it through the incus to the stapes, multiplies the sound 20 times as it moves through. The stapes strikes the oval window. That vibrates, and then pressure is passed to the fluid inside the cochlea. The cochlea contains three canals: the vestibular canal, the cochlear canal, and the tympanic canal. Inside the cochlear canal is the sense organ for hearing, which is known as the spiral organ, or the organ of Corti. The spiral organ has little hairs and a gelatinous material called tectorial membrane, and the hair cells sit on a basilar membrane, and their stereocilia are embedded into this tectorial membrane. When the stapes strikes the membrane of the oval window, pressure waves move from the vestibular canal to the tympanic canal across this membrane. So here's your picture of the cochlea. You can see the semicircular canals. There's a different canal oriented in different planes of space. The oval window, which contains the stapes attached to it. The round window a little bit further down, and the cochlea on the side, which is shaped like the snail's shell. Inside of that cochlea, you can see the three different canals: vestibular canal, cochlear canal, and the tympanic canal. In the middle canal, which is the cochlear canal, is that organ of Corti, which is going to allow you to hear. As the hairs bend in this area, it transmits an electrical impulse through the cochlear nerve up to the brain, so the brain can interpret it as sound. Here's an up close of that spiral organ. You can see the gelatinous material here, which is this tectorial membrane. As it vibrates, it bends those hairs, mechanoreceptors, so they need movement. That's going to send the impulse through these little nerves. And here they are magnified again. from there, the basilar membrane is going to move up and down. The stereocilia of the hair cells embed in the tectoral membrane, and they bend. And the nerve impulses begin in the cochlear nerve, travel to the brain. When they reach the auditory cortex, which is found in the temporal lobe of the brain, they are interpreted as sound. Each part of the spiral organ is sensitive to different wave frequencies or pitch. And as we get older, the higher pitches are the first nerves to become damaged. Rotational equilibrium pathway. Mechanoreceptors in the semicircular canals detect rotational and or angular movements of the head. This is called rotational equilibrium. Again, the three semicircular canals are arranged so that one is in each plane of motion, and they have an enlarged base in each semicircular canal called an ampulla. Each ampulla contains hair cells with stereocilia embedded in a cupula structure. As fluid within the canal flows and bends a cupula, the stereocilia are bent, and this changes the pattern of impulses carried in the vestibular nerve to the cerebellum and the cerebrum. Your brain takes this information and uses it to make postural corrections. Our other type of equilibrium is known as gravitational equilibrium, and it depends on the utricle and the saccule. Both of these are membranous sacs located in the vestibule. Both of these also contains hair cells with stereocilia embedded in an otolithic membrane, which is a gelatinous material. The large central cilium, which is called the kinetocilium, calcium carbonate granules, which are otoliths, are going to rest on the otolith membrane. If the stereocilia move away from the kinocilium, nerve impulses in the vestibular nerve move. And if it's upside down, the nerve impulses cease. All this data is going to go to the vestibular cortex, and your brain is going to use this to determine the direction of movement of the head at that moment. And this is how your brain maintains gravitational equilibrium. So here's your picture. This is showing you rotational equilibrium. And in rotational equilibrium, when you rotate your head, it bends that gelatinous material. The hairs bend, sends an impulse up to the brain. Gravitational equilibrium would be like bending your head downwards. You can see the little granules or otoliths in this gelatinous otolithic membrane. When you hold your head down or up, it's going to cause those little granules to move. The membrane's going to sag, and that's going to send the impulse to the brain, letting your brain know which way your head's facing. The end of the chapter talks about disorders of taste and smell. The sense of smell starts to decline after age 60. Some people are born without a sense of smell, and that's known as anosmia. There are other factors that can contribute to a decrease in the ability to taste and or smell, and these are going to include things like upper respiratory infections, allergies, exposure to certain drugs or chemicals, including smoke, tobacco smoke, and also brain trauma, including brain tumors. Extent of loss can be tested using the lowest concentration of a chemical that a person can detect and recognize. Sort of like a scratch and sniff sticker for smell. For taste, the chemicals are applied to the tongue. Disorders of the eye include color blindness. Complete color blindness is rare. The most common type involves a deficiency in one type of a cone. Red-green color blindness is the most common. However, it's an X-linked recessive trait, which means it's going to be more common in males than females. The test for color blindness looks similar to this, with multicolored dots and oftentimes numbers or patterns hidden within. Another disorder of the eye deals with visual focus. Nearsightedness is when people can see close objects better than distant ones. In this case, the eyeball is a little bit longer than it's supposed to be, and the image is brought to focus in front of the retina instead of on the retina. This one's corrected by concave lenses, which diverge light rays so that the point focus is further back. Also, farsightedness is another visual focus disorder. These people can see distant objects better than close ones. In this case, the eyeball is shortened so the image is brought to point focus behind the lens. This is corrected by a convex lens to increase the bending of light rays so the point is focused further forward. Most people, however, can see a size 20 letter from 20 feet away, which results in 20/20 vision. However, over the age of 45, most people begin to have trouble seeing objects close up because of a condition called presbyopia, where the lens of the eye begins to lose its elasticity and cannot focus on close objects. So here's our picture of nearsightedness. The eyeball's a little too short. Here's our picture of farsightedness. And last is our picture of an astigmatism, which is an uneven cornea or an irregular shaped lens. And in order to see properly with an astigmatism, you have to have an unequally ground lens. Oftentimes, people with an astigmatism have problems seeing an image that's fuzzy because the light rays can't be focused on the retina. And a lot of people undergo laser surgery called LASIK to correct visual focus problems such as these three. Another possible eye condition that causes blindness is known as retinal disorders. Retinal disorders are going to include diabetic retinopathy. In diabetic retinopathy, which is the leading cause of blindness in the United States for those people under the age of 65, the capillaries to the retina become damaged with hemorrhages and blocked vessels. This can be treated with lasers to seal the leaking blood vessels, but eventually scarring will cause blindness. Careful regulation of blood sugar may be protective and preventative for this disorder. Macular degeneration is another retinal disorder. In macular degeneration, which is common over the age of 50, cones are destroyed because of the thickened choroid vessels. They no longer function as they should. And finally, our last retinal disorder is a detached retina, which usually results because of a trauma. Detached retinas can be reattached as long as this disorder is caught quickly, and the procedure uses lasers to reattach that. Another common cause of blindness is glaucoma. Glaucoma occurs because drainage systems of the eyes fail. It's rarely present at birth, but it can progress quickly, so routine or regular visits to your eye care specialist is necessary for treatment. And our last common cause of blindness are cataracts. Cataracts are cloudy spots on the lens. Increase in age increases the likelihood of cataracts, and it will eventually pervade the whole lens or cover the whole lens. The lens itself takes on a milky white to yellowish color and cannot transmit light. Men who smoke more than 20 cigarettes a day and women who smoke more than 30 cigarettes a day are at an even greater risk of developing cataracts, as well as exposure to UV light, a heavy alcohol consumption, and diabetes. Cataracts can be treated with the removal of the lens and the replacement with a clear or artificial plastic lens. It is the most common surgery in the United States, with greater than 1.5 million surgeries per year. Lots of disorders of the eyes are associated with UV radiation, so the best thing you can do is wear sunglasses to absorb UV light. And here's a picture of a cataract on the human eye. You can see that cloudy lens, which would cause blindness in this particular eye. Our last disorders are hearing disorders and disorders of the equilibrium. Hearing loss can be gradual or all at once, and there's lots of causes. In the young especially, infections can lead to impairment if they're not treated properly. 1 in 3 people over the age of 60 have hearing loss. So most of the time this is because of the mobility of the ossicles. Those three tiny bones decrease as you age. Sudden deafness can occur all at once or over about 3 days. It can also be present at birth due to infections with German measles or rubella, and also the mumps virus contracted by pregnant women. It can occur in one ear or both, usually only one. And trauma, side effects of some drugs, and also infections can cause this. Sometimes it resolves itself. Sometimes medical treatment is needed. And deafness at birth is generally going to be either genetic and or an environmental cause, such as a pathogen the mother had while pregnant with the child. The last one is otosclerosis. In otosclerosis, new filamentous bone grows over the stirrup and it impedes the movement. Sometimes this runs in the family and is usually caused by years of frequent exposure to loud noises. Our final disorders are disorders of equilibrium. Vertigo is a feeling that a person or environment is moving when they're not. It can be caused by problems in the brain or problems in the inner ear. About 20% of vertigo patients have benign positional vertigo, or BPV. This is because of formation of particles in the semicircular canals. Most cases of BPV resolve on their own or can be cured with a series of precise head movements. These head movements are designed to cause the particles to settle where they no longer stimulate the stereocilia. Certain disorders affect both hearing and equilibrium. Meniere's disease is caused by an increased fluid volume in the inner ear. About 80% of the Meniere's disease patients have only one ear affected, and this generally occurs between the ages of 20 and 50. There is no cure, but it is manageable with a low-salt diet. It's characterized by vertigo, a feeling of fullness in the affected ears, tinnitus, which is a ringing in the ears, and hearing loss. Any hearing loss that is acquired during Meniere's disease is permanent.